Hello, Martin Petts here from F24 and welcome to this next video in our series Covid-19 Preparing for the Next Wave. Today we'll be talking about staff health and well-being, but firstly I think it's important to communicate to staff that all this will pass. Things will truly get back to normal at some point, but in the meantime we really need to support our staff as well as our families. Many of your staff will be asking, will this Covid-19 pandemic end and when will that be? So population immunity or herd immunity or a vaccine or both will be the main ways that this pandemic will end. So a vaccine could potentially take 2 years or more before it's ready. You've got to make sure you manufacture enough to supply enough of the population. But you also got to remember that you may, without having a proper testing cycle, you may have mistrust in the population. Not everyone will want to take a vaccine that's not been tested correctly. So herd or population immunity, so those that have had COVID-19 may or may not be immune to the virus. I've not seen a definitive report on that anywhere. Countries that have actually had high infection rates like Italy, Spain, UK or even Sweden may be much more well placed for a second wave or a reinfection wave because they may have higher immunity. Those other countries that have done a really good job and governments have broken the chain and kept infections very low, like Australia and New Zealand, may actually suffer more in the future with any second waves that comes along, giving more infection, actually more infection than potentially the initial wave of COVID-19. On the other hand, COVID-19 immunity may not be permanent. This is why this crisis is so difficult to manage from a governmental level. So this also reinforces why we need to be prepared, as we've discussed in other videos, but also we need to support our employees the best we can. COVID-19 could be around for a while yet. Staff health and well-being is often neglected in most crisis situations, and especially during the COVID-19 crisis. So there can be many reasons for stress or mental health issues during this COVID-19 crisis. For example, there can be worries about physical health, especially when it comes to catching the virus, worries about the ability to do one's job, worries about losing a job or the company you're working for going out of business. Difficulties accessing healthcare can be difficult right now. Isolation from friends and family during lockdown, even reliving traumatic events that some people may have experienced in the past. Additional childcare responsibilities and not being able to care for your families. Being too busy to work from home, being interrupted too much, fear about not getting enough done. Worrying about friends and family members that are vulnerable. But change is always difficult for people, adjusting to the new normal. Business sectors becoming less sustainable in the new normal. Having to be more flexible. All these things can have an impact on people's stress. Organisations need to be aware of these reasons for increased stress and at least try and address some of them. Companies can move staff from less needed areas into areas that need more resource during the COVID-19 crisis, and maybe operate a buddy-buddy system or a mentoring system so that stress is not increased in people that are new to roles and they're guided by people that are more experienced in those roles that the new person has been seconded into. Communicate company and general updates as frequently as possible, hopefully using an emergency communication system that's going to provide reliable updates. Use a COVID-19 hotline where staff members can call in and get regular updates on what's happening. Communicate the direction of the company. If things have to change in terms of the way the company is doing business, make sure staff know what's happening. Reassure your staff and communicate. Communicate. So let us know how you're supporting your employees right now. Don't forget to subscribe to this channel, but thank you very much and bye for now.